Thank you. Mike Eastland, Commissioner of Insurance. What I'd like to do today is briefly outline our approach to how we'll go about implementing this act, and then Ms. Longley will go through some of the key milestones that have to be met in implementing the insurance market reforms. At a strategic level, I can best describe TDI's approach to implementing this with three elements. One is charting a course by time, meaning that there are certain things that have to be done by certain dates. It can't be organized in terms of least controversial to more controversial. I mean, the feds have been very clear in the bill, and while we're anxiously awaiting HHS guidance on some of these things, there are some milestones that we're looking at today, and obviously takes us well beyond 2014. Second, we'll be reaching out to all affected stakeholders and all involved governmental entities. This nation's never seen a policy undertaking like this in several decades. I mean, this is huge. And for any one or two agencies, and I want to again echo Commissioner Sees what he said of working together, and we'll continue to do that. There are a lot of moving parts that have to be at the table in order to synchronize this thing and make it work so that your average Texas citizen, should this act be upheld, at the end of the day, it's got to work for them. And third, we'll be preparing for the full range of scenarios. Again, with a bill of this magnitude, you never really know. While we can look at it on paper today and see this is what we've got to do, you never really know what's going to happen. I mean, there could be court decisions, Congress could come back and make amendments. And so the best thing that we could do at TDI is be prepared for just about anything, not just what's on paper today. There are two areas that I like to focus on in terms of our overall strategic approach. One is outreach, and the other is, again, preparing for the range of scenarios. In the outreach to stakeholders, this is going to include perhaps one of the largest consumer education efforts that we've undertaken.
What page are you on?
Sir, I'm not on a page at the handout right now, but I'll be happy to provide my notes to the committee. Ultimately, millions of Texans are going to have to learn how to buy health insurance, whether you're an employer that's never purchased insurance or an individual that has never purchased insurance. And then you're going to need medical budgeting information and how to use that insurance product in the medical marketplace. And then ultimately, you're going to need information on transparency of costs, because even with the federal standards for the benefit plans, you're going to have some out-of-pocket costs that up to this point, because you don't have an insurance policy, you may not have had to pay at some point. And again, you're going to have to know how to start rearranging some of your own personal finances about how to participate in this new system. At TDI, we have had a number of experiences with helpinsure.com, texashealthoptions.com, the Texas Sure program, as well as our toll-free lines and consumer publications that have had to span not only many cultures and languages, but different generations and technological limitations in terms of how Texans learn how to participate in the marketplace. And regardless of which agencies get the various provisions of the bill to implement, we'll bring those to the table at their disposal. In preparing for what could happen with this bill after this hearing concludes today, the one thing that troubles me the most is the economics around this. And right now, no one knows to the dollar and to the person ultimately what the impact is going to be. I think there's a lot of theory out there, and actually some probably beyond theory, but all these multiple variables that we're having to analyze, they're not really going to show their true weight until 2014 and still beyond in the out years. And the reason I bring this up is not just to manage the committee's expectations, but what we can tell you today about the impact down to the individual, to the exact dollar. But there's this burning question out there about, okay, how much is this going to cost, and what am I going to get out of this, which is, I'm sure, what your average citizen is at least wondering at some level in the back of their minds. I would caution against what anybody would stand up and say, we think it is going to cost this, because I charted no less than 10 economic variables that don't act in a linear fashion. It's much more random and chaotic than that. And so the economics of this are going to unfold as we get into the implementation of this. And lastly, on the agency impact, I'm safe in saying we're going to need more people, and the technology and the training that needs to be wrapped around those people so that they're effective public servants. But today I could say I could need as few as 5, I could need as many as 35. And so again, as we get guidance from HHS, and we can also better understand as well as better predict what federal funding may be available to the states to implement this act, then again I'll be able to tighten up what the agency fiscal impact is as the months go on.